Good afternoon. For this presentation, we were tasked with interviewing a clinical specialist. I'm Zachary Wagaman.
I'm Trey Faber.
And I am Aaron Dorch.
For our first question, we asked Dr. Temeka Lewis out of Winchester, Virginia. Did you do a residency as part of your education? And if so, where was your residency? She responded with, yes, I completed a PGY1 general practice residency as well as a PGY2 critical care residency at Charleston Area Medical Center, or CAMC.
Our second question was, what was your base salary coming out of pharmacy school? She answered with, in regards to my residency salary, it was $42,000 per year. Her base salary her first year as a critical care clinical specialist was almost $129,000 a year.
Our next question for Dr. Lewis was, how many hours on average does she work per week? She responded by, in her residency, she worked about 60 to 80 hours per week, and in her new role as a specialist, she works about 40 hours per week.
In the next question, we asked Dr. Lewis, can you give us a general idea of what you do as a critical care specialist? She responded with, currently she works in a 48-bed ICU. As a critical care specialist, she participates in multiple disciplinary rounds and makes medication therapy adjustments for her ICU patients. This includes reviewing orders for appropriateness, indications, dosage, as well as drug-to-drug interactions. Some of the most common recommendations in regards to sedation and vasopressor medications. She also is a part of an antimicrobial stewardship team. Therefore, she reviews antibiotics and culture results as well as makes interventions for appropriate lengths of therapy and de-escalation. Furthermore, she responds to code blues and other rapid response calls. As the critical care specialist, when she's not providing patient care, she's involved with multiple hospital committees such as the Critical Care Committee, Nutrition Support Committee, P&T Formulary, and ASP Committee. With all these committees, she works to develop policies, procedures, and protocols based on best practice to improve patient outcomes.
Next, we asked her what aspects of the job to her are the most appealing. She answered for her patient care and working with a multidisciplinary team at the bedside are the most appealing. She's always loved critical care medicine and the adrenaline and chaos that it can bring.
Our next question for Dr. Lewis was, what aspects of her job were the least appealing? She responded by saying, I am learning to enjoy the managerial aspects of my position, the meetings, the protocols, development, etc. But this is definitely the least appealing part of her job.
The next question was, what advice should students and practitioners consider when selecting the option of becoming a clinical specialist? She responded with saying, it's a lot of work and a lot of training. Make sure that us as students do something that we are passionate about. And she went on to further say, if she was involved in another specialty, such as ambulatory care, she would not have the increased satisfaction that she currently has. She furthermore said, to become a clinical specialist, this requires residency training, and residency was one of the hardest years of her life. But it was completely worth it in the end. She loves her job now, and she knows many pharmacists who graduated with her who are already burnt out because they did not love what they do. She told us to make sure that we look at the big picture and envision what you see yourself doing in the next 30 years of your life. Do not just look at the short term, because she knows a lot of people who did not consider residency because they did not want to spend 1 to 2 years of their life in training, and they decided they needed to make a full pharmacist salary right out of school. But now just in a couple years into their career, they are miserable with what they decided. Due to the progression of clinical pharmacy, it is getting close to impossible to get a hospital position, including a staff position, without residency training. Most institutions are now requiring at least a PGY1 residency for their staff pharmacists.
Next, we asked Dr. Lewis what a typical day for her would look like. She arrives to work at 6:30 a.m. Then she walks to the ICU and addresses any emergency issues from overnight or from the early morning. She also performs pre-round on patients and does chart reviews. From 8 to noon, she does multidisciplinary rounds, medication orders, and follows up on patients. From noon to 3, she has meetings, office time, addresses any emergencies or issues that may arise, and if she has students or residents, this time would also include topic discussions, patient presentations, journal clubs, etc. This schedule can vary based on the clinical status of patients in the unit, if she has a resident or any students on rotations. So although her schedule is fairly set, it changes every day and can be very exciting for her.
Our next question for Dr. Lewis was, what led her to becoming a critical care specialist? She stated, I have always enjoyed critical care, emergency medicine. In pharmacy school, these topics, sepsis, acid base, vasopressors, toxicology, and emergencies were the ones that I enjoyed learning about the most. She found them easy to remember and apply. Also, these were the ones that she didn't mind studying about or reading about. For her, other specialty areas, including ambulatory care, oncology, and internal medicine, just did not appeal to her. And as a P4 student, during her emergency medicine and cardiology rotations, she discovered a passion for emergency and critical care situations. She enjoyed responding to codes and loved seeing the impact that a critical care pharmacist could have on patient outcomes. It was instant gratification for her.
For our 10th and final question, we responded with, what led you to becoming part of the profession of pharmacy? And in her answer, she started working in a hometown independent pharmacy at the age of 14 with a worker's permit. Her grandmother at the time was a technician there, so she helped stock shelves and run the cash register. At 16 years old, she studied and passed the Virginia Pharmacy Technician Boards. And she stated for her, pharmacy just clicked. It was something she wanted to be involved in. It was something she wanted to do in the future. She could remember the drugs, both brand and generic, and what they were used for before she even graduated from high school. She said it was very interesting for her. She also liked the job flexibility, and she stated that no one can deny that they are attracted to the kind of salary and the potential salary that they can make once they get out of pharmacy school. She said obviously at this point in her life, and even during her first year of pharmacy school, she thought that she would go to pharmacy school, and upon graduation, she would train under the pharmacist she worked at the independent pharmacy when she started working at 14, and eventually buy the business and try to own her own pharmacy. But during her IPI rotations, she experienced a whole different side of pharmacy that she didn't even know existed, which was hospital pharmacy. And at that point, she knew she wanted to be a clinical pharmacist. So she wanted to round bedside, she wanted to make clinical interventions, and by her P4 year on rotations, she knew critical care was where she specifically wanted to be. So now, as we ended the presentation, we just want to reflect upon a few things from the responses that we received from Dr. Temeka Lewis.
One thing that I was very surprised with was how much money she made during her residency. She stated that she made over $40,000, and I definitely didn't expect that. So upon learning that, Residency is something that I wanted to do anyway, but knowing that you can make a pretty decent salary doing a residency has definitely pushed me towards going that route.
Another thing that surprised us was what she found was least appealing about her job was her managerial position. Because to me, it seems like a lot of students, when they graduate and become pharmacists, they want to reach that top level as high as they can reach. And for her, as a pharmacist working as an ICU specialist and being a manager, I thought that would have great benefits for her, and I thought she would find that very enjoyable. But she actually stated that that was the least appealing thing about her job, so I just found that surprising.
What I found very surprising was that she was initially interested in actually not only working in a community setting, but owning her own pharmacy. And that is a completely different route from what she ended up as she's working in a clinical setting in a hospital. And that shows me that you're not always going to know what you want to do, and you can't decide what you want to do until you've experienced everything. So right now I'm interested in hospital pharmacy, and I've experienced it a little bit in previous shadowing, but I don't know the full extent of what I would be wanting to do quite yet, and I can't know for sure until I experience those different aspects of the pharmacy field, such as industry, community, or hospital clinical care. Or I might even find something that's completely different from anything that I've thought about up until now.
When we asked Dr. Lewis what her starting salary was, she initially responded with that she didn't think the question was very appropriate. So this is something we can take into consideration when completing further projects, that maybe asking someone's salary isn't always the most appropriate question.
Thank you.
Thank you. Have a nice day.